Hello, my name is Benjamin Dolph. I'm an environmental health specialist with the Humboldt County Department of Health and Human Services, Public Health Division of Environmental Health. Having been born and raised in a rural part of Humboldt County, I've spent a lot of time outdoors and learned that with all the natural beauty, it's important to remember that there's also plenty of things out there trying to bite us, sting us, and make us itch, and in some cases spread disease. Today I'm here to talk about one of my least favorite, and that's ticks. Ticks are present year-round, but the biggest health concern is usually in late spring and early summer, when the babies, called nymphs, are more present. Ticks hunt by climbing to the ends of grass and brush, holding their front legs out, waiting to latch on to anything that happens to walk past them. There are a few ways to avoid getting ticks when you're outdoors. Light colored clothing makes it easier to see them, and tucking your pants into your socks can help prevent them from getting out of sight. Repellents containing DEET and the more natural option of oil of lemon of eucalyptus, or OLE, have been proven effective. Just be sure to follow the instructions on the label. For pets, talk to your veterinarian. There are quite a few effective products on the market. Doing a tick check and showering after returning home also makes a really big difference. If you do find a tick that's bitten you or your pet, you should remove it as soon as possible. The best way to do so is with fine-tipped tweezers. Grab the tick as close to the skin as possible and pull straight up. No need to twist. If you don't have tweezers, dental floss also works. Just make a small loop with the floss around the tick, tighten it up close to the skin, and pull straight away from you. Be sure not to squeeze the body. That could make an infection more likely. If you do get bitten by a tick and want to find out if it's carrying Lyme disease, testing is available through the DHHS Public Health Laboratory.
Hi, my name is Jessica Reynolds. I'm a laboratory technician at the Humboldt County Public Health Lab. Here at the county lab, we can test ticks for Borrelia burgdorferi, the bacteria that can cause Lyme disease. When receiving a tick for testing, we will first identify the species of the tick. On the West Coast, the ticks that transmit Lyme disease are Ixodes pacificus, commonly known as deer ticks or the western black-legged tick. If the tick is an Ixodes pacificus, we can test it to see if it has Borrelia burgdorferi in its midgut. In order for a tick to transmit bacteria to its host, it needs to be attached for a while. For Lyme disease, this can take around 24 hours, which is why it's best to remove a tick as soon as possible after it attaches itself. To test for bacteria in the tick, we cut the tick open and squeeze its gut material onto a slide. We then use an antibody stain that is specific to the bacteria that is linked to a fluorescent marker. Then we look at the slides under a fluorescent microscope. If the bacteria is there, it can be seen by the presence of a fluorescent signal. When collecting a tick for testing, make sure to place it in a sealed container or a plastic bag and include a moist paper towel or cotton ball to keep the tick from drying out. Ticks can be brought in person or can be mailed to the Eureka Laboratory for identification and testing. There is a charge for this service. Turnaround time for the test is usually around 1 week. If you do develop symptoms, please seek your healthcare provider to discuss treatment options. Thank you.